What is postpartum psychosis?
We define postpartum psychosis as a gender-specific collection of diverse mental illnesses characterized by the sudden onset of psychotic symptoms following childbirth.
There are 3 specific classifications that make up postpartum mood disorder.
The first one is most frequently seen in women. Actually, up to 70% of women suffer from postpartum blues, which usually commences within 10 days after childbirth. Postpartum blues include symptoms such as insomnia and emotional outbursts, and it clears spontaneously. Luckily, it does not impair mental functioning.
Next, we have postpartum depression, which affects 10 to 15% of women and is more severe than postpartum blues, and shouldn't be ignored. It progresses in severity over 2 to 3 months after childbirth and includes symptoms of depressed mood, excessive anxiety, and mood swings.
Finally, the most severe and least common of the 3 classifications of postpartum mood disorder, with only 0.1 to 0.2% of women diagnosed, and our main topic, postpartum psychosis, is known usually to commence within 2 to 4 weeks following childbirth. So, what is happening to your body that causes postpartum psychosis?
Within just 48 hours, there is a rapid shift in the hormonal environment. Thyroid hormones are high during the pregnancy and fall following the delivery of the infant. A change in metabolism, loss of placenta hormones, as well as a dramatic decline in the concentration of estrogen and progesterone, combined with the alterations of adrenal secretions of cortisol, which are high late in the pregnancy and peak during labor and delivery. This is the result for the mood disturbances. Cortisol is known to drop dramatically after the childbirth and works its way back to normal over the next month. As expected, this all causes major confusion for the human body. Who's at risk?
Postpartum psychosis occurs in 1 in 1,000 women who are pregnant for the first time. Women who experience traumatic and/or complicated births, such as cesareans, preterm delivery, or low birth weights, infants are at a higher risk as opposed to women who have a natural healthy births. It has been demonstrated that stressful life events during pregnancy near the time of delivery appear to increase the risk and likelihood of postpartum psychosis. It is known that psychosocial variables tend to play an important role in determining vulnerability during the postpartum period. Research has looked at links between personality traits and coping style versus the risk, but they have only found inconsistent results. Interestingly enough, having a female child can also play a role.
Although it is difficult to find specific constant psychosocial variables that predict postpartum psychosis, it is known that women with a family history of mental illnesses such as schizophrenia, bipolar disorder, and mood disorder are more likely to be vulnerable to postpartum psychosis. The risk of being diagnosed with postpartum psychosis increases by 30 to 50% after each delivery thereafter.
Some of the triggers of postpartum psychosis include being trapped in an unhappy marriage, lack of paternal support, and increasing amounts of stress. Research has shown that marital status remains an interesting factor and that married women are at a greater risk.
As well as having an unwanted pregnancy and being fearful of mothering. Some symptoms of postpartum psychosis are severe anxiety, panic attacks, insomnia,
restlessness, severe depression. Disinterest in infant is when a new mother may have negative thoughts or be completely disinterested in her new infant. A serious side effect of this is the inability for the baby and the mother to bond. This is crucial for the baby and the mother at this time.
The opposite may also occur: obsessive concerns about the infant, always being overly concerned about the child's well-being. This can lead to extreme stress and anxiety for the mother. An example of this would be the mother is always overwhelmed by thoughts that her baby may get sick from germs, so she washes the baby's bottles for hours at a time. It is easy to see that very quickly this symptom could take over an individual's life.
Emotional instability that leads to confusion and irrational thoughts. Over-intrusiveness, which inhibits infant's rest. Waking the infant constantly to check whether the baby's okay will lead to infant's exhaustion and on occasion, death.
Fearfulness of being alone with the child, and manic behavior.
Lastly, the two symptoms that are classified as postpartum psychotic episodes, which more often than not lead to infanticide, are
Command hallucinations, which include visual, auditory, and olfactory. Delusions that the child is possessed. Often this leads the mother to thinking that her child is trying to kill her. Diagnosing postpartum psychosis is difficult because many symptoms resemble those of postpartum blues and depression. Screening is done by our obstetrician, gynecologist, and midwife. Postpartum psychosis is suppressed, ignored, and rarely admitted by many mothers as it can be embarrassing and frightening. It is normally thought by mothers that they are able to deal with this mental illness without the help of others. Some studies report that less than 1/3 of women seek help.
Some women may report depressive symptoms for months, but no other symptoms are talked about. This leads to a delay in proper treatment. The lack of knowledge of postpartum psychosis has led to a limited amount of research attention. It is encouraged to be aware and to be specifically checked out for postpartum psychosis, so always make an appointment.
There is a various amount of treatments and strategies to prevent postpartum psychosis. Precautions such as not leaving the infant alone with the mother if she is known to be delusional or thinks about harming the child, as well as being aware of suicide attempts.
Good to excellent prognosis are associated with appropriate treatments, which can be anything from antidepressants to sleeping pills, and are supportive family networks and a strong premorbid personality. An important treatment is psychosocial and psychological interventions, which leads to psychotherapy, individual and marital. Many women prefer non-pharmacological interventions due to transmission of medications through breast milk.
In the most worst case scenario, postpartum psychosis has a very high risk of infanticide, filicide, and suicide if it goes untreated.
It doesn't matter your economic status, social status, age, race, or ethnicity. Postpartum psychosis is not selective and can be quickly overwhelming and challenging to any new mother.